Hey guys, hi, welcome back to another session on Unacademy. This channel is Unacademy Future Doctors, and I'm your educator for biochemistry, Dr. Shivangi Shukla. Let me just check if the live stream has started or not. Let me check if I'm visible and audible to everyone. Just give me a second to check if the stream is running fine. Am I clearly visible to everyone? Am I audible? Do let me know, guys. Do let me know if my video and audio both are clear to you. Okay, great. So this session is a strategy-based session, specially dedicated to the new students who have just entered MBBS first professional examination, and for those who have to take the NEET PG entrance examination. Okay. So here I'll be discussing about how you have to go about studying biochemistry. Okay. So as most of you would know, I'm Dr. Shivangi Shukla. This is my introduction. We have been together for the past 6 months here on this platform, on this channel. And I'll just, till the others join in, I'll just quickly brief you about the NEET PG subscription available on the Unacademy app. Now you can access the NEET PG subscription using either the Plus or the Iconic subscriptions. Through both of these subscriptions, you can access the video lectures, both live as well as recorded, of the top medical educators across the country. Okay, and not just their video lectures, but also live as well as recorded quizzes, combats, all India level combats, then question banks containing more than 25,000 questions, which are regularly updated, and which contain an exhaustive list covering most of the important topics. Then you also get to access the printed PDF notes of these educators, and also the USP of this is that you can access these while on the go on any device of your choice, be it your phone, laptop, tablet, or even in the comfort of your homes on your PC. Okay, and all this while enjoying the simulated classroom environment of a physical classroom, because you get to enjoy the state-of-the-art tools like raise your hand feature, ask it out feature, and the newest development is the open house features. Open house sessions allow you to take 1:1 audio sessions with your mentors, that are the educators. So any doubts that you have regarding your preparation, any strategical doubts, any academic doubts, you can pose those doubts and during the open house session. So your privacy is also not compromised because it is an audio session. It is just like talking over phone with your mentor. Okay. The Iconic subscription will in addition give you resources from Prep Ladder as well. So depending upon your choice, depending upon your requirements, you can go for either of the two subscriptions. Also, one very important announcement is that because the NEET PG examination is just round the corner in May 2022, Unacademy has come up with this rapid revision batch involving more than 40 educators, and they'll be conducting subject-wise tests and grand tests and also revision lectures. So for those of you who are serious about taking this attempt, it is very, very important for you guys to enroll in this batch, because it is a win-win situation. Okay, you have a disciplined revision in these last 2 months and a rapid revision with great pace. Okay, understood. Also, do not forget to put in the educator code DRSHUKLA, Dr. Shukla. This code is DRSHUKLA. This code is going to fetch you an additional 10% discount on either of the two subscriptions, be it Plus or Iconic. Okay, Dr. Shukla, DRSHUKLA. This code will fetch you an additional 10% discount. Okay then guys, coming back to the topic of discussion for today, that is how to study biochemistry for entrances. Not just entrances, for any other exam. So, okay, alright. So for those of you who have just entered college in your first year, you guys would not have started with your studies, I guess. But the thing is that biochemistry contains a lot of topics which we have already studied during our PMT preparation. Okay, during our pre-medical entrance preparation only, we have studied quite a lot of topics in from biochemistry, like nucleic acids, like metabolism part, the metabolism of biomolecules part. Also, a lot of topics we have studied, like introduction to biomolecules, isn't it? We have studied in great detail in PMT. Structure of different carbohydrates, different types of structures, then lipids, then about proteins we haven't studied much in PMT, we don't study much, but carbohydrates and all we have studied in great detail. Then carbohydrate metabolism also we have studied in great detail, like glycolysis we have done the HMP shunt, we have done Krebs cycle, isn't it? All these we have done the urea cycle, but not in great detail. We have done only the superficial part. We've done only the part that is, we haven't done the analytical part. That is important here. Okay, we have done it just for a fair, to develop a fair enough idea. Isn't it? Isn't it like this? So now what happens is, now during your first year, you will be uh, learning more at a clinical level. Okay, while in your before you while you were in school, you were learning more at the level of the theory part. But now what you're going to do is you're going to focus mostly on clinical applications. Okay, like if you know all about glycolysis, you will now read about how to associate glycolysis with the other cycles or the other pathways inside the body. Then you'll study it as if it is happening in real time. And then there'll be applications of glycolysis, different phases of glycolysis, like how enolase, an enzyme in glycolysis, is inhibited by sodium fluoride. Now, what is the application of this? Is inhibited by fluoride ions. Now, what is the application? Sodium fluoride lined vials, they are used for collecting samples for blood sugar. What is the utility? That will inhibit the enzyme enolase, and therefore the red blood cells present in the blood sample will then not metabolize the blood sugar, the glucose present in the sample, and it will not come falsely low. Okay, so this is what it is. This is the main. So there will be a lot of applications like these. I remember during PMT, I had not focused on what are the reversible and irreversible steps of glycolysis and the DCA cycle or the Krebs cycle or the citric acid cycle. So, but I did not know the utility of that. But once I got into the first year, I realized that this is what is important, because the Krebs cycle is associated with transamination reactions and gluconeogenesis. Similarly, the opposite of glycolysis happens in gluconeogenesis. So you should know about those reactions which are reversible and those reactions which are irreversible, because the irreversible reactions will require a different set of enzymes. So the first takeaway from what I have been blabbering for the past 2 minutes is that now you should, not just for biochemistry, for any other subject, now you should develop a clinical analytic approach. Okay, till now what you have been studying is at the face value. Even if you have the ability or you have the aptitude to study things after understanding, which should be it for every student. Every student, no one should do rote learning. That is what my funda is. You should not be dependent upon rote learning. Whatever you are reading, you should make sure that you remember it for as long as you wish to. And that can happen unless and until it is some kind of facts and figures, which does not matter. In today's age of the era of the internet, it does not matter about how many facts and figures you know or you don't know, because it is just a click away. The access to all facts and figures is just a click away. So you cannot impress anyone by knowing a lot of facts and figures in today's age. In today's age, how you can impress someone, or it is not about impressing, it is just about being confident in by yourself, is that by understanding concepts. Okay, but in MBBS, what is more important, what is even more imperative for you is that you should associate whatever you are reading with your body, with the human body, because medicine is what it is the study of the human body itself and the different diseases that it can undergo, it can suffer from. So whatever you are reading, this is your base. The first and the second year form your base, your formative years in MBBS. And time and again I have reiterated that the first and the second years are the most important for MBBS. Even though they may seem to be the most boring, the most tedious, the most difficult, but they are the most important. Why? Because they form the basis, the foundation of the third and the final year. Now, in the third and the final year, you will be mostly learning about the clinical applications of whatever you have read in the first and the second year, be it anatomy, be it physiology, be it biochemistry, be it pathology, be it pharmacology or microbiology or forensics. So all of these are very important. Now, for those of you in the first year, I would like to advise you guys to be I would like to advise you guys to be really diligent about your these three topics, these three subjects, that is anatomy, physiology, and biochemistry. All right. If there's any doubt, okay, I'll take a break for 2 minutes because I've been speaking non-stop. If there's any doubt, you can ask me here. Okay. Do let me know if there's any doubt. So what I have been telling is that you should focus on the first and the second year the most. Okay. All right. And then in the first year, what you should majorly focus on is how to develop, how to associate whatever you are reading uh, with the human body, with the clinical application part. Okay, understood this? Okay, so then what you should focus majorly on in biochemistry. Now we have to focus on biochemistry. First of all, what is the first important question is which book to follow. Okay. Now, which book to follow? This is, I have already told you, I always mention that mostly what you should follow is those books that are followed in your school, in your college. Okay, whatever books your seniors have been following, in whatever books have been followed in your college, are being followed in your college, you should follow those books. Okay. What I have followed in LHMC in Lady Harding, where I did my MBBS from, there we used to read Harper's. It is a very well written book, easy to understand, very well structured. You can follow this. The other books in the market are Satyanarayan, Vasudevan. These are few important books. My personal favorite is Harper's because it is a very well written book and it is exhaustive, and it is very easy to read for exams also. Okay, all right. And then okay, and so this is about the books. Okay, then what is there is, you should, one very important thing that I always mention is that you should not forget, never forget to revise, never forget to buy a book for past papers that contains past papers. Okay, past papers are very, very important. Okay, now for your exams, for your for your university exams, past papers for from different past papers from previous years. They can be in Delhi University. There used to be a book called Step 1, Step 2, Step 3, right? So those contains past paper. Those contained past papers. Those books, okay, past papers for different subjects. Now, for MCQs, for entrances, you should always have MCQ books containing past papers, past year papers of NEET examinations or AIMS examination, INICET examination, whatever. That also you should always practice. Very, very important. Okay. So yeah, so this is it. So books and past papers, they should form your basis. Okay, just one book. Do not go after multiple books. One book should be your basis, your foundation. Do not go after a lot of books. And past papers, solve a lot of past papers. Okay, and for your university examinations, past papers you should form the basis of understanding what is important and what is not important. Okay, because the course is a lot, it is a diverse, varied course. So depending upon the past year papers, past year questions, you can ensure as to what is important and what is not important. Okay, for reading, so that you can focus more on that part. And for entrances, make sure that you have solved at least previous 5 to 7 years past year papers. Okay, so that you know what are the important topics that you should focus on. Okay, so now after that, what you should do is, for your university exams, you should make sure that you do not miss any internal exam, any internal test, be it practical or theory. Do not miss it. Even if you know that you'll score a zero, even if you know that you might even score in negative, and that you'll receive a lot of bashing, you'll receive a lot of slack. Sorry, you'll receive a lot of flack, and you will be embarrassed and ashamed in front of the whole of the class. Okay, still do not miss any internal test. Okay, why? Because if you attempt the test, then you will know what are the questions that are important. And for any test, once you attempt the test, you can go back and then quickly revise those questions, the answers to those questions. And once you have attempted the test, then even if you don't know anything, but once you will be studying for the professional examination, you will be automatically, your mind will click whenever you will read that topic. The Suppose you have been asked about the HMP shunt and you have not prepared during that internal test. But just before the professional examination, when you are preparing, and once you come across the HMP shunt, you will know that yes, I have to focus on this because I was quizzed on this. Okay, and automatically your brain will be more vigilant. So always attempt tests. Okay, and just go back and revise the questions, or check the answers for those questions that have been asked in the internals. It is a very, very good way to cover a lot of syllabus in a less amount of time. Similarly, do not miss any practicals as well. Okay, so this is for the university exams. Then what you should do is, you can, first of all, you can there are two ways in which you can study fast. You can either, if you have made notes in your lectures, well and good, you can revise your notes, and you can quickly go through the theory, the base book that you have formed. Okay, keeping in view, aligning it with the past papers, with the topics that have been asked time and again in the past papers. Okay, and then while you have, if you have a lot of time, you can quickly watch these lectures at 2x speed so that you can reinforce what you have read, or if anything, if there's anything that can be added, you can add it there. Or if you're feeling very jittery, or if you have this inertia of starting reading from notes, or if you haven't made notes, if you're someone who cannot make notes and you find that the book is too tedious, too big to be studied, then you can start from the video lectures. Okay, these lectures that are available on Unacademy and on YouTube. You can watch any of these lectures on any of the topics that you find difficult, and then once you have understood from these lectures, you can go back and then read very fast from your textbook. Okay, so these are two ways, either reading and then watching, or watching and then reading. Any which way, it will reinforce, and it will make sure that you remember the topics very well, what you have read. Okay, then do not forget. So this is read and then watch, or watch and then read, whatever suits you. Whatever suits you. Okay, then next is what? Next is answer writing. Do not forget to illustrate your answers. I'm not asking you to make a lot of flowery diagrams and all, or to make a lot of diagrams. What I'm asking you to make is, even if you don't have diagrams, even if you don't know about diagrams, make tables, make flowcharts, make some line diagrams or some symbols. So they will make your answer more illustrative, or answer in points. Do not answer in drab paragraphs. Okay, because the examiner has to check a lot of copies. Okay, loads and stacks of answer sheets he has, and until and unless the answer is catching his eye, he will just look at it and he will give it some mediocre marks, and then he'll let it go. And God save you if you have illegible handwriting. Okay, so do not. So this is what is. Always make sure that your answers are well illustrated, well structured. They have a proper format. In biochemistry, there should be. I have made sure that all my notes through which I'm teaching you, they're all handmade, handwritten, so that you get an idea of how to attempt answers. I load them with diagrams, with figures, with structures of different biomolecules, all these things. You should also do that. Okay, understood. So this was about the internal exams. Then for entrances, what you should do is, again, your base book. Okay, your notes, if you have made them. Then again, video lectures. So through these, what you can do is mix and match. Either read and then watch, or watch videos and then read. Whatever suits your personality, whatever suits the time that you have, and whatever suits the speed with which you are reading. Okay, then again, every preparation should be based on past papers. Okay, You should solve at least 5 to 7 years past papers and a lot of mock test practice. Okay, it should be properly timed and they should be full length tests so that you develop the ability of sitting for long time and you can test your brain that whether your brain is getting exhausted, because what happens is after sitting for a lot of time, even when we know the answer but it cannot be recalled because the brain gets a lot of exhaustion, the brain becomes exhausted. Okay, so now I'll stop for another 2 minutes. You guys, now you ask me. It is open. This session is open for any doubts. If you have, you can ask me your doubts. All right. Now, for those of you who have just passed out from the first year and have entered your second year, now one very important tip is that keep reading pathology and pharmacology. Pay a lot of focus on these two subjects because they are going to form your base. Okay, and side by side, do not lose touch with your first year subjects. How? You can solve MCQs, you can watch video lectures whenever you get time. Okay, so through that you can be in touch with your first year subjects. No need to go and revise theory again and again. That you can do in internship. But do not, the case should not be that once your first year has gone, then the next time that you open biochemistry is for preparing NEET PG, for preparing for NEET PG in your internship or in your drop year. Do not do that. Keep in touch with it through video lectures, through MCQs, solving MCQs, so that you're always informed and all these topics are always fresh in your memory. Okay, now you have a lot to read in your second year, so you cannot afford to go back to the theory part again and again. So that is why I'm telling you now, since the theory part is fresh in your memory, you can use it to your benefit by reading a lot of by watching a lot of videos and solving a lot of MCQs. Okay, understood this? So now it is open, the session is open for you to ask your doubts. Just ask me your doubts, whatever doubts you have, okay? Regarding preparation, if you're in the first year, second year, whatever year you are in, or you're preparing for entrances, whatever your doubt is, you can ask. Okay, so yeah, so now I don't see any doubts coming up. Now let me quickly inform you about the 11 p.m. session, 11:45 p.m. session that I have on the Unacademy app. It's a special class, that is MBBS, that is MCQ bonus biochemistry sessions, the 44th lesson in the league. So do join me on that in that session on the Unacademy app, and we'll be discussing a lot of MCQs. Now I hope you guys have benefited from this session, and if there's any doubt, you can ask me in the session. You can ask me either here or you can ask me in on the Unacademy app. Tomorrow also I'll be taking up 3 sessions here on YouTube, MCQ based discussion sessions, and at 11:45 I'll be taking up another MBBS session on the Unacademy app. Okay, so do join me today at 11:45 on the Unacademy app for the special class. Okay, guys, then see you. I hope you guys have benefited from this, and if there's any doubt, you can ask me. Otherwise, we can conclude this session. Okay. So all the best for everyone, for all of those who are preparing for the NEET PG examination this year, for all of those who have just entered college in the first year, for all of those who have just passed out from the first year, for those of you who are pursuing, who are continuing in your MBBS second year, third year, final year, your internships, everyone, all the very best for any exams that you're taking. And just make sure that for exams, your main strategy should be to follow one base book and practice a lot, and do not read unnecessary stuff. Focus on smart study, and the best way to study smartly is to align your studies with past papers of any exam that you are taking. Okay, so these are the three important mantras for any kind of exam. Okay, do not study unnecessary stuff, study smartly. Always align your studies with past year papers. Okay, practice a lot. Mock tests, practice a lot of tests, and always minimize your sources. Keep just one base book on which you can add on different facts which are missing there. Okay, understood this? Alright guys, then thank you. See you at 11:45 on the Unacademy app. Bye bye.